So we made, I think, what is one of the greatest discoveries in neuro rehab and physical rehab too. We discovered in this office, within the past 2 years, we discovered how to recalibrate the foundation of the brain. So there's 3 systems that I would consider are the foundational system in the brain. And when these 3 systems are perfectly calibrated with one another, we could say that we recalibrate our brain's compass. Our perception of where we are in space and where things are around us is perfected. It's not just for balance. The impact is on all systems because it's so deep and foundational that it can have an impact on cognition. It can have an impact on mental state. It can have an impact on how we move. It can have an impact on our balance. It can have an impact on the structure of our spine, on our muscle tone, on our digestive system, on our immune system, on how we process pain, and so much more. And so, we call this method the gravity reset method. The gravity reset method, I believe, is a method that should be practiced in every chiropractic office, by every physical therapist, by every occupational therapist. And now there are many optometrists who have already learned this technique and are starting to apply this technique in their offices. And that's just like chiropractors have a great interest in neurology, optometrists study the brain and they have a great interest on neurology. Now here's the thing, those 3 systems, one of the 3 is the visual system, so you can understand why they're so interested. It's the visual system, it's the vestibular system, and it's the somatosensory system. Somatosensory is all these receptors we have in our joints and our muscles and our skin, all these receptors that allow us to feel our body. The vestibular system are the receptors in our inner ear that give us a sense of motion. Not just motion, but also a sense of gravity. We'll touch on that a little bit more in a second. And then, of course, the visual system, which is such a dominant, powerful system that taps into every part of your brain. And so what if those 3 systems are not perfectly calibrated, where maybe the visual system saying one thing, the somatosensory system is feeling something different, and they're sending signals into the brain, and the brain feels like, well, who should I believe? We're getting 3 different stories. And that is probably what I would think is the greatest potential drain of energy that you can have when these systems are not in sync. And so,
how do you know when they're not in sync?
Great question. So there's a lot of different ways that we can go about testing that. We can assess eye movement control. We can assess balance. We can also do other more specialized tests. Now, because these systems are interconnected to everything else that the brain does and the body does, we're learning more and more signs that indicate that there is a misconnection in those systems. Now, I mentioned balance, and if you're a patient here, you've probably been on a balance pad when you come in here. So I look at balance all day long, and we've established very specific patterns that are associated with specific regions of the brain that may be affected. And so I'll talk more on that as we move along, because I'm going to show you some before and afters of some of the different tests that we use in here. So you'll get to get that question answered. But since we're talking about gravity and how we relate to gravity, well, we know that there's lots of studies on astronauts when they are removed from the gravitational field. And here we get to see, we know that there are so many conditions that are related to being in space and being removed from the gravitational field. Well, there are numerous and many more conditions that can be related to not having an appropriate relationship to gravity. So these are just some of the common ones, like bone loss, blood flow, vision impairments, bacterial imbalances, cellular damage, psychological stress, sleep disturbance, nasal congestion, immune disorders, and, very importantly, flatulence. Now we know it's a problem. All right, so these are the big 3. right? The big three. So we hear big three, those are the three foundational systems. They are the vestibular system, the visual system, the somatosensory system. In layman's terms, it's your brain's compass. It's what allows you to know where you are in space and where things are around you. Now, in more severe cases, people will feel like they're almost disconnected from their body. Like they feel like their bodies is maybe not theirs, or it's kind of numb in some way. Sometimes it's brain fog, sometimes it's just low energy, sometimes it's dizziness, and sometimes it can manifest in so many different ways. So we can't necessarily just go by the symptoms. However, there are some symptoms that we know are just more likely to be linked to this system. What I am finding, because I check everybody's balance, is that 85 to 90% of the people I check have a disconnection within the system. Now, what is it like in the population out there? It may be different, but I have checked the balance of over 4,000 people in the past year and a half. I'll say 4,000 visits, so same person many times. So it's not 4,000 different people, but 4,000 patient visits. And I can tell you that the vast majority, it's very rare that we find someone who is perfect, but it happens and they're there. So with that being said, the big three are visual, vestibular, and somatosensory. And I'll make a big effort to not take too many questions so we can get through and then ask questions at the end, but I'll let you take it. Since I let Becky ask her questions, Catherine got it. So third and last? Yeah, front row only, yeah.
So were we born perfect? Or
in God's eyes, yes.
were we born synchronized? This three?
So that's a great question. So when we're born, our brain cells are starting to differentiate. So we have all these these stem cells, and the human cortex is not born fully separated and differentiated. And so it shapes itself and it forms through our movements and experiences. So movement is critical, not only, movement through visual perception, but also through sensation. As you're feeling your body, you're experiencing different situations, and you're getting up and you're falling, and you're developing the relationship between those vestibular sensors in the inner ear. Right here, there's 5 on each side. We're developing a relationship between them, between vision, and between our muscles, our movement, our limbs, and these systems are starting to connect. If trauma occurs early in life, it will absolutely interfere with a normal, proper development. And it could be all sorts of different kinds of traumas. So what if we don't get a chance to move the way that small babies are meant to move? What if, so you can think of all sorts of scenarios that can interfere. What if there's an illness, there's a virus early on, and that virus seems to have had a great impact on the brain's development? That can happen too. So, children have all sorts of consequences that happens in their life, and as parents, it's, you feel like when you have a little one, you feel like it takes years off your life because you think they're going to die any second, right? So yes, so I hope that answers your question. I want to share with you this story. This is one of the most moving stories that we've got to experience here. And this was really early on when we were first kind of testing out this gravity reset method. And this patient came in, I'll show you how she came in initially, very difficult to move her body. So you could say that her body coordination, so you have all these spasms, we call those dystonias, really affect her ability to control her body the way she wants to control it, okay? This is the same week, 5 days later, third visit, and you see how she's moving there, right? It's a lot better, a lot easier. And I used to really run away from these kinds of cases because I just never had that kind of success before. This is her visit number 4. See, I'm not a great editor, Graham. Visit number 8, right? Very good movement, life-changing. Visit number 8 is like a year later, by the way. I didn't see her very much. We got so much success in a short amount of time. She came back and I said, wow, you're doing so great. We got all these recordings on how you walk. Let's do another one. So it lasted, right? We created change in the brain, and the brain kept on building on it, on its own through everyday experiences. We opened up a door, and then the brain just took it and ran with it.
Wow.
And so this technique, and I would say it's something that just landed on our laps in here, but is so powerful. I'm showing you one case, but it's so powerful, it has the potential to change many lives. So I am a mentor in our profession, and I am a teacher. So we teach this method on a regular basis. And there's doctors from all over the world that have taken our courses and taken this particular course. And I get reports regularly saying, oh my goodness, I've been in practice 40 years. I've never seen anything that works this well, this predictably and reliably on a regular basis. And it's exciting. I want to share with you a text that I got yesterday from a friend of mine who came in here for his chiropractic adjustment, and I said, you know what, let me just check your balance first. And I gave him just a few little exercises to do on his own. We barely did anything in here. I said, do this at home and you're good to go. It was one of those really fast visits. And so he did. Every day, he takes 2 minutes a day, and he does his exercise, and he sent me this. He says the list keeps on growing of things that he's noticed improve in his health. But he said he's had low back and lower body pain for decades. That pain's gone. His balance is better. He's sleeping better. His singing is better. His handwriting improved. He's off antidepressants, and he's off ADHD meds. And he said, I probably got many more things to share, but he just sent me this text yesterday. Like, wow, this is awesome. And so there are many things that I had no idea until yesterday that all of that had changed for him. I see him and say, hey, how's it going? And we kind of pass by. But this was life-changing for him. And it's life-changing for so many people. And now so many people in other countries are getting to benefit from this. So I just want to share with you just how significant this is. And so we have this responsibility now of getting this out. And so this is an article, this is not even a new article, but it's an article from the 90s that's talking about the connection between the vestibular system and the rest of the body, and more specifically the autonomic system, but really the rest of the body. Remember, there's 5 receptors on each side. Of those 5 receptors in the vestibular system, 2 on each side feel gravity. Those 2 receptors, in all my years of neuro rehab learning, we've never once heard of any strategies that target or utilize those receptors. Those 2 receptors on each side, they're called the otoliths. It's the sacuole and utricle. The names don't matter, but I just want you to know they're real, they're there. They are the single most powerful receptors we can use in the brain to leverage for just about everything. I'm not saying it's the only thing you ever need to use, but it is where we absolutely have to start. And that's what I want to make sure that we get across. So the connection between those receptors, and they're in here, they're mentioned in here. I won't read the whole thing, but basically, there's a strong connection to the autonomic control. The autonomic system is the part of the brain that controls everything that our body does without our conscious control. Heart rate, blood pressure, digestion, immune function, all of those things that happen, that we don't even have to think about it. It's just automated, the autonomic nervous system. And there's 2 main branches. There's that fight or flight branch and that rest and digest branch, all right? So we'll name them that for now for our purposes. But when we calibrate this vestibular system, and especially those 2 gravity receptors that never turn off, and that's why they're powerful, they are always on. Always. Every millisecond of every day, they are firing nonstop, whether you're sleeping or whether you're awake. Wow. The other 3 receptors, they're on when you move your head, and they're off within 7 seconds. Those are the ones in vestibular therapy that we all use, and we've been using for decades. Those little 7-second ones. And we're not doing anything about the ones that never stop firing. The ones that that give you your postural response and your physiological response to gravity. They're so powerful. Never have I seen anyone teach on how to leverage them. That is gravity reset. And we found a way to recalibrate them. And that's what's so powerful about it, because they could be overfiring, and that's what happens with a lot of these autonomic issues, is we have this overfiring, or they could be underfiring. Okay? We can recalibrate them regardless. Motion sickness, you've heard of that? You're in a car, I can't sit in the back. That's all gravitational. Blood pressure, respiration. I'm not saying that every blood pressure problem is due to a gravity reset issue, but what I'm saying is that it's part of the problem. It's always involved in some way. Sometimes it's enough to make a difference, and sometimes it's not. We got to do other things as well. Hypotension or orthostatic hypotension is when you stand up. This has become very common. There's a condition called POTS. It's a dysautonomia, one of the main multiple kinds of dysautonomias, POTS. And it's a condition where when you stand, your blood pressure can drop or your heart rate can rise or both, right? So when that happens, in more severe cases, you can faint. Or in less severe cases, it affects your mind, where you may have brain fog or other dizziness or other kinds of conditions like that. So anxiety is a big one, right? Have you ever heard of anxiety? Obstructive apnea, sleep disturbances. And the reason why sleep is in there is because the vestibular system, when it's overactive, it's hardwired to a part of the autonomic system that drives that fight or flight. It's like the gas pedal. So we have a gas and a brake, the fight or flight and the rest and digest, the gas, the brake, all right? The vestibular system is only hardwired to one of the two. It doesn't touch the brakes. It's only wired to the gas pedal. And if 90% of our population has a disconnection, if you will, or an inappropriate relationship within their big threes, they need a gravity reset, their gas pedal is on. Even when they're sleeping all day long, there's a little bit of gas there that shouldn't be there. Their foot is never totally off the gas. So it can manifest in a lot of different ways. Now, our options are, do we just put more weight on the brakes? Well, you still have the foot on the gas. And that's the tricky part. And I used to struggle with that, especially with concussion rehab. Light sensitivity. Oh, well, we've got to do something with the eyes. No, we don't. Absolutely not. We don't have to do anything with the eyes. I test pupillometry now, where I can actually measure objectively what is the size of the pupils, how they respond. And in those patients who've had concussions, we can get all those metrics. And what I'm seeing is, even in seconds of doing a gravity reset, it can normalize. And as we keep doing gravity reset, we have lots of patients here that have had concussions, and we're seeing all of a sudden, oh, I'm not sensitive to light anymore. Oh, I can think more clearly now. Oh, my balance is better. And that gravity reset method is allowing us, even though we were helping people in the past before gravity reset, we can help those people now much more efficiently at a higher success rate and a whole lot faster than ever before. This is my son 2 years ago, and I just want to show you that he didn't have any complaints. We came to the office, and I checked him, and look at his balance. Look, he's eyes closed. He's a hockey player. He could barely stay up on the pad. Look at that. He could barely stay up on this balance pad. And so his complaint was not anything that you would think of. It's more like, hey, my back hurts. Like, you're 9. I'm a chiropractor. Let's go to the office. Okay, and then, and I'm sorry, I was talking while I was going, but the second half of that video was him after we did a corrective maneuver. And he was standing on the pad, no problem. We have the same outfits on. I'm just recording, through the reflection of the windows in our office. It was late at night, office was closed, and we got to do that. And it made me realize, wow, how many other kids his age who are not complaining about anything, to your point earlier, these young kids, how many of these kids need that? I mean, I've seen other kids that had knee pain, and we do a gravity reset and the knee pain gets better. Not after doing everything else, because that was not my first thought. My first thought was, oh, we can laser this thing, we could do pulse on this thing, we could do adjustments, I mean, there's so many things that I would think of doing before doing that. And then nothing worked. The young tennis player, that was his story. And then we do gravity reset and like, oh, pain's gone. And it doesn't come back. Isn't that amazing? So we don't always know, how would it present in one person or another. This is an 11-year-old, okay, with learning and reading difficulty. Look at this. We get to record eye movements, okay? So we have a special device that records eye movements. So this is him trying to move left, right, left, right, left, right. And look at this one. See how much cleaner that is? These are 3 visits apart. Same week. Before the beginning of the week, end of the week. No home care. He's got 20/20 vision confirmed by an optometrist. But look at this. This boy, same person obviously, but this person here trying to read and learn, do you think that would be a lot harder than this one? Absolutely. The eyes cannot move in a controlled, predictable pattern. They should take the same path. Now, same boy, look at this one. What about the verticals? That's a lot worse. It looks like a snowstorm. Nice and clean over here. And look at this one. This is eyes still. Look at a target. Keep your eyes real still on that target. Look at how scattered it is here and how more concentrated it is here. Life-changing for him. This is a boy who thinks, these are his words, there's something wrong with my brain. I don't know what it is. There's something wrong. He's just trying to go to school and be a normal kid. There's something wrong with my brain. What is it? What do we do? Where do we take you? Psychologist? Where would he go for this? And so these are the receptors that we're talking about. 1, 2, 3, 4, 5. They're all in there. Utricle and saccule, these are the 2 gravity ones. And they respond to linear movement, side to side, forward and back, so like in a car, right? So we always are moving forward in the car. So you'll see, it's very rare that you'll see people moving forward in this office. People are walking sideways or walking backwards, but forward, only on your way in and on your way out. And that's because, we do, through our everyday activities, there's a lot more of a forward predominance. Naturally, that's how we're designed. And so I want to share this information mostly because the hallmark of gravity reset is canceling a reflex called the TVOR. VOR is a vestibular ocular reflex. Again, you don't have to remember all these technical things, but I just want to at least give you a little bit of an understanding of what's happening. So when we do a gravity reset method, you'll see people holding a target, looking at the target. They'll wear glasses with a laser on it, and that laser comes from the head and it goes to the target. So the eyes look at the laser on the target. And we wear a band that's weighted so we can feel the head better. So we get the sensory component, visual component, and linear vestibular component. But the head, the eyes, and the target are perfectly in line and they move together. That is the hallmark of the gravity reset method. The question is, which direction do we need to move for you? How do we need to position your head? Is it center? Is it off to the side? Do your eyes need to look here, here, here? Do we need to cover one eye or the other? Those are all sorts of variables that can come in. Do we need to translate you in a chair? Do you need to be stepping? Do you need to be going upstairs? Do we need to add in some kind of rhythm, like a metronome that you need to match? There's all sorts of layers that can be fit in there to really fine-tune what your needs are, or to upgrade your level of intensity. Okay? Why is it so powerful? As I was reading some of my textbooks, I came across something really powerful that really got me to understand, wow, we made this discovery, but why is it so amazing? What's happening? How is it that we can do a gravity reset and we can see such dramatic change in eye movement control or balance, sometimes in seconds? The reason why is because the TVOR, not the RVOR, so RVOR is angular movements of the head, translational, right? The RVOR taps into those canals. There's 7 seconds, right? 7 seconds versus always on. Remember that? So TVOR is the gravity receptors. TVOR taps into those gravity receptors. The difference is because it has a close functional relationship with other foveal stabilizing systems. What that means is this. Here's the eye. The back half of the eye right here is all retina, okay? The fovea is this little piece right here, this little part. So when you concentrate on details, you're fovealizing. Everything goes right on that little part right here. When you're reading, right, it's all right here, right there. Retina captures everything in the background. Anything that comes into your eyes, boom, it hits the retina, right? So you could be focused here, but when you're moving and the background moves, that's a lot of that too, that background info hits the retina. So the RVOR affects the retina. The TVOR affects the fovea. I know it's technical, but hang in there. Smooth pursuits and vergence. Smooth pursuit is when you track an object like this. That's a smooth pursuit. They have a very close functional relationship to the TVOR. Vergence, looking in, looking out, your eyes coming together, and divergence, right? That's very common. Kids that have a hard time reading, a lot of times they have a hard time converging their eyes together, all right? So what we're finding is that when we do the gravity reset, they improve, and we have the proof. And I'll show you some more cases so you could see that it is consistent. But the calibration of the gravity reset really affects a part of the brain called velocity storage. This is something that was very confusing and very few people ever heard before. So you're amongst few people. Velocity storage is a term that we're going to hear and talk a lot more in the future. But more and more, just in the last year, a lot more studies came out on velocity storage. And all that is to say is it's the part of the brain that receives all these motion signals. They come in, and this is where the brain gives you that interpretation and says, okay, we are moving slowly. We're moving fast, this distance. And they're moving here, he's moving there. Think of athletes that play in sports. You're capturing motion of so many people and yourself, and your brain's constantly calibrating where everybody is. Think velocity storage. How does your body respond to your movement, or even to your stillness and balance? Or how does your body respond to people around you? Long time ago, and I wish I saw this patient today, not 10 years ago, I had a patient who just the slightest sound, I could just clap my hands and it would throw her on the floor. Velocity storage really high because it responds to sound too. And so we found a way to recalibrate velocity storage. That's another way of saying that's what gravity reset is. And this is what all of vestibular rehab would absolutely hate, right? Anything peripheral, like these canals, we have all sorts of techniques to address those. But when it comes to the brain, it's like, what are we going to do about it? I don't know. We didn't know. We tried different things for years and years and years. Gravity reset recalibrates this in seconds. These things keep recalibrating on a regular basis. So what is velocity storage? It is the central element of a multi-sensory internal model that senses head rotation and velocity optimally. It provides the egocentric rotation velocity signal to the 3D generator. Basically, it gives you this idea of where we are in 3D, where our whole body is in space, where we are, like I said earlier, where are we in space and where's our environment compared to us. So that plays a critical role in, again, that 3D model of vestibular information processing. Now, what is the consequence? The consequence is childhood learning disorders. The consequence is an athlete's performance, job performance, energy levels, healing potential, sleep quality, gut health, posture, balance, muscle tone, so much more. So this is a 10-year-old. Again, I'll show you some adults too, but this is a 10-year-old with back pain. Not my son, this is a different person. This is over 2 visits, so look at the before and look at the after. Not perfect, but a lot better than what we had before. And look at the total score, 18 to 39. That's a pretty good jump in just 2 gravity resets. It takes less than 5 minutes to do a gravity reset. We did it twice. Again, you can see quality of eye movements improving, Look at before, look at after. It's much leaner and cleaner. And this is horizontal movement, much better, right? 2 visits. So you could see again, look how scattered his gaze was. He's trying to fixate on a fine point, and much better after. Now we look at brain processing speed. He went from 900 milliseconds to 653 milliseconds. So can this affect mental capacity? Absolutely. Gravity reset for an adult with ADHD, 3 sessions over 5 days. Look at these eyes. So this is both eyes trying to follow a target in a circular pattern. The left eye just tucks right in and kisses the other one. And this is what happens in 3 sessions. Now, I'm showing you pretty dramatic cases. I don't want to make it sound like we have these miraculous responses with everybody in 3 visits or less. It doesn't work out that way. Not always. But we get a lot of people who notice a big difference pretty quickly. This is, again, same person. See how messy this was here with the left eye and how much better it is? Look at the vertical pattern right there, that big curve, and now nice, clean, straight, and lean. Again, on the horizontal, much better. That left eye wasn't even reaching the target, and now it's on target. Okay, again, powerful. So let me show you what happens to the same person. Again, the eye's right over here, should be there. This is what happens, same person. Let's check him a year later, because that's the big question. All this happened in a short amount of time. Well, is it going to stick? Same person. This is the first visit. Remember the eye kissing the other one? Second, this is third visit. We saw these already. And this is the 5 more visits over 10 months. So we go almost a whole year later. And he gets his best score ever. I must say that those 5 visits were kind of clustered. And they were closer to the earlier visits. So he went a long period of time without me seeing him. And when he came in, I said, let's just go check and see how you are. And that's what we got. So this is just to kind of give you a picture of what it looks like when you do the gravity reset method, when we calibrate those big 3 systems. We have the headband, the glasses, and the target, and they all move together. In this case, it's in a chair, but it doesn't have to be in a chair. In some cases, it does, but we could do side-stepping or back-stepping and things like that. So some of the common symptoms that we see more commonly associated with the gravity reset being disconnected are going to be eye movement control dysfunction, difficulty with concentrating, reading, fatigue, headaches, migraines, feeling disconnected, balance, motion sickness, cognition issues, learning capacity, memory, dizziness, vertigo, dysautonomia, difficulty sleeping, anxiety, postural imbalances, musculoskeletal compensations, pain in various areas of the body. That story that I read off my text earlier, he had that, all this stiffness and tightness. He said, it's gone. So again, I don't want to make it sound like this is the only cause for all these problems. It is not the only cause for all these. There could be other things in there. But what we're finding is it has such a powerful impact for so many people. In this case here, we see a Y deviation. Y deviation is basically when one eye kind of veers up and out like that. This is a Y deviation. You go on the vertical. This is same visit before and after. This is a classic finding for someone who has an otolithic imbalance. These are these gravity receptors in the inner ear, where they're not firing at the same rate. Another classic finding, and I see all the time when I watch shows on TV and you see an actor that has a chronic head tilt, like they're always going in the same, right? That, they need a gravity reset, absolutely. But that's what happens. The eyes will counter-rotate, and that's how it shows up. But before and after, same visit. You know, this was literally, we moved 5 feet, went back, recorded again, boom. That's what happened. So, okay, this is over 2 weeks, 1 visit. Look at this eye hanging down here. We call that a skew deviation. It happens a lot with head tilts, where one eye appears higher than the other. People who've had those a long time, you'll see, my goodness, every time I talk to them, I see that one eye pop right up nice and high. But it can lead to pain as well, like neck pain and back pain. And you can see the change before and after. So going to go through these kind of quickly because I've got other information to share with you. But I want to give you a sense of how powerful this is. Again, you can't even see the eye there. It's down here, really low. 5 months later, same person, hardly any treatment. So there's the first, there's the second, and there's 5 months later. And you look at these numbers, I won't get into that, but even the quality, the efficiency of movement get better. And motion sickness. So this person here, motion sickness, you can see again, this is pretty classic for motion sickness. Well, you see that one deviation here, and it cleared up and improved. So more and more research is coming out. And this particular article is basically to establish that connection between the otolithic system, right? That's that term. Again, you don't have to remember it, but those are the gravity receptors. It's the connection between the gravity receptors and the autonomic nervous system. The autonomic nervous system, and I test it on everybody now, the autonomic nervous system is critical. That's what makes the difference between someone who has little stress and feels overwhelmed by stress and anxiety and someone who has a ton of stress and they feel like, I'm good, no problem, right? It's the autonomic nervous system when it's out of balance. It's that foot on the gas. And when we do a gravity reset, we can take the foot off the gas. I was talking about that earlier, where if you get really wound up and your fight or flight system kicks in, the vestibular system, when it's overactive, will put the foot on the gas, and it needs to be recalibrated. And so this particular article has a ton of information in it. But to make it short and sweet, the purpose of the article was to delineate the association between the otolith function and those gravity receptors and the changes in mean orthostatic blood pressure and heart rate in patients with postural orthostatic tachycardia syndrome, POTS, which we talked about earlier. There's so much depth in this article. I'm not even going to come close to cover it, but I just wanted you to know that the conclusion was that there is a connection, and that the connection is with especially an augmented utricular input. Augmented, meaning overactive, and that's what gives you that gas on the pedal, anxiety, high stress, difficulty sleeping. I mean, if you're wound up, it's hard to go to sleep, right? And so when we really tune this system and recalibrate it, it takes the foot off the gas. Many times we also have to do other things to build the braking systems. The thing is, everyone's unique and different. We can't really say, oh, you're a POTS patient or dysautonomia patient, therefore we'll do the protocol. The same protocol for everyone. It's not. It's like, there's a saying in our field where we say, if you've seen one concussion patient, you've seen one concussion patient. That's it. Like, there's no two that are identical, ever. So, and that's why chiropractic neurology was born, because we need an individualized approach for each individual brain, period. And so that's not how the medical model is designed.